Hello everyone, my name is Kim Miller. I'm a lead profitability coach with Inspired Hygiene, an international speaker, and a columnist for RDH magazine. Now, if you are an Inspired Hygiene aficionado and you follow us and you've listened to our videos and you're tracking with what we're doing in terms of promoting and encouraging dental professionals to treat periodontal disease early, to recognize periodontal disease early and treat it early, you are already aware that in November of 2016, a very interesting piece of research was published. The title of this paper is called High-Risk Periodontal Pathogens Contribute to the Pathogenesis of Atherosclerosis. Now, this article was written by Bradley Bale, Amy Doneen, and David Vigrist. Now, Bradley Bale and Amy Doneen are the authors and the teachers of the Bale-Doneen method, which I have taken several times and a big follower of the two of them, both physicians. I want to read just a short excerpt from this article from the discussion section. It says that it is reasonable that periodontal disease due to the high-risk pathogens AA, PG, TD, TF, and FN be considered causal of cardiovascular disease on clinical grounds. Understanding that high-risk periodontal pathogens are causal of heart disease or arterial sclerosis places an onus upon our dental colleagues, that would be us, to continue their efforts to develop affordable, reproducible, objective testing for high-risk periodontal pathogens. So what this says to me is no longer are we thinking that heart disease and periodontal disease may be related, or that periodontal disease may be associated with the progression of heart disease. We now know that these high-risk pathogens are causal for the number one contributor to death and disability in our country, which is heart disease. So essentially, this piece of research is telling us that with good periodontal care, we can slow down this epidemic of heart disease that we have in our country. And I'm going to be so bold as to say that we can save lives by treating periodontal disease early and by eliminating these pathogens from our patients' mouths. My question for you today is, now that you know this information, what are you doing about it? Are you taking it to the street? Are you talking with your patients every day? Are you saying to your patients, Mrs. Smith, I'm so glad you're here today. I wanted to share some important information with you. We now know that the bacteria that cause periodontal disease can also cause heart attacks and potentially contribute to strokes, and of course we know the connection with diabetes. Are you taking the time on a daily basis to tell your patients this information? This is groundbreaking research. We now have this research in our hands. We know that we can help our patients overcome their problems with heart disease simply by treating their periodontal disease. Share this information with your patients. I think it will make a difference.